Perfect. Well, like I said, I just appreciate you taking the time to chat with me today. And so I want to make sure I'm saying this right, but Dr. Quartano with me today, owner and of Altogether Wellness, which has been around for a little bit, if I am not mistaken. Very similar background as myself, but can you just introduce yourself and then kind of tell us how you got here?
Yeah, well, thank you. First of all, it's my pleasure to be here today, and I thank you for having me. Yeah, so I was at the PT, sort of like, well, not sort of exactly like you, right? Went the residency route after graduation, which really lent itself to becoming an evidence-based practitioner. So I was able to dive into the literature to seek out the answers. I think that was one of the biggest values that residency training taught. So after that experience, I went on treating in pediatrics and neurology, which are certified areas of specialty, and really found that there was such a limitation in practice, right? So all of our patients have so much we are really, really good at treating. So I was in the home. I was practicing in early intervention at the time, and really realizing that what this family did on a day-to-day basis, that intimate home environment, which I was blessed to be part of, made such a difference in their health. So through that journey, I started to explore functional medicine, started working on my own health simultaneously, realized what a massive difference that made. Now come full circle, and I do still treat. We have a whole rehab team, but we also practice functional medicine in our practice.
Wow, awesome. Your audio is breaking up just a little bit.
Okay.
You sounded great now, but I don't know if it was from hair or anything like that. So I'll
Okay.
interrupt you if it happens again.
Yeah.
So can you just to bring it back for a second, can you tell people what residency is? And like, not a lot of people know that the physical therapy model has changed over the years. So, and I know you were heavily involved in residencies in your past, not only in it, but help coordinating it. And so you're through and throughout residency trained. And so just fill some people in on that.
The residency training is very much what you think of from a medical model in terms of graduating as a PT. We have a license, we can treat. It's very much a generalist. So moving into residency allows us in a particular area. So in that way, it's a lot like the medical model. So I went through very early on residency, for relatively new, a little while. But I went through neuro residency training, and I was certified in neuro, and brain injury was really my passion area. But I love pediatrics and collaborating on. So after I finished the neuro residency, sat for my board certification, I went back and created the pediatric residency program, and sat for the board for pediatrics so that I could build that program as well. So built the program, ran the program for 7 years, loved being able to treat or teach pediatric people how to specialize in their expertise. But at the same time, I was growing my own skills and to really expand on that into. I actually am still involved in residency, still mentor the Brooks residency program here in Jacksonville, and I still accredit other programs.
Awesome. Yeah, that's really cool. My residency training was different. It was more of a hybrid model, and I appreciate the different models, but I think it's safe to say that a lot of people are attracted to Brooks Rehab because of their residency, and you were a part of building that, which is amazing, and just shows your background and what how long you've dedicated to improving your patient outcomes. And so I don't think enough can be said about that. I think it's really important. Of course, I'm biased, and I'm sure you are a little biased as well. But like you had mentioned, I think it just really allows you to hone in your skills. And so I can always appreciate that when I hear clinicians that went through residency, and you're double board certified, right?
Yeah, pediatric.
Yeah. So not only your expertise is there, but you have no problem shelling out some dough to get some of those credentials as well.
Right. And I think, to speak to your and anybody who's gone through the residency training, right? It's not easy. So that dedication to learning and commitment to your patients, I think.
Yeah. I think a big difference is, we don't have to do it. and the physician model may say you have to in some respects. We go above and beyond, and I know in the models that you were in, like you take a pay cut, you sacrifice a ton of your time just so you can better your patients and better your clinical reasoning. So and I think that speaks to a lot of other systems that are bringing physical therapists to the table and talking about developing better healthcare and better systems. And those who are further trained are bringing the whole profession up. And so I definitely appreciate you doing that. I'm a firm believer in that, but I think that's really cool. Really, really cool. So when you went into the patient's homes and you started talking about learning about the home environment and then moving into functional medicine, is that correct?
Yeah.
So tell me a little bit about that, because I don't know a ton about functional medicine.
Sure. Yeah. So functional medicine is really looking for the root cause of what's going on. Think about it in this. Sorry.
That's okay.
All right. There we go. If you think about it, most of our medicine is really addressing at-risk, right? So we target symptoms. We look for outcomes, not so much in rehab. I think we're pretty good at getting to the underlying cause. But if you have a cold, you go to the doctor and they give you antibiotics. Maybe not for a cold, but you know what I mean.
Mm-hmm.
It's really a treatment for the symptoms you're driving with, instead of saying, why is this the third time we've had a cold this year, right?
Yeah.
And so functional medicine starts to get to the root cause of why immunity might not be, the nervous system might not be, and their hormones might not be optimized, and what's going on in their body and lifestyle. So, kind of bringing that back to what I was doing, going into the home, I was seeing a lot of families where family function in chaos, right? And add a child with a disability, and so eating a lot of fast food. We weren't sitting together at mealtime. There was no routine. The child didn't know what to expect, so that's stressful on them. And so just kind of bringing the whole picture of health back to the family so that we could actually get to the physical improvements that I was there.
Yeah, that speaks so much. And I just don't think I've used that term before. But anybody in our shoes that have the opportunity to go in someone's home and really look at their life and how it impacts their symptoms has been practicing that for a long time now, right? And now you're able to put some words to it and really put it in the patient's eyes of how important it may be that they consider all of those factors in their health, and not only in their rehab process, but staying healthier for longer.
And so functional medicine, a lot of times aligns where you'll hear it overlapping with integrative medicine or naturopathic, but I think there's more of a blend between allopathic medicine and using medical treatments as needed, but looking at prevention. And so after residency training, because I didn't do enough, I actually did another committed program for about a year, diving deeper into functional medicine. I have the ability to look at labs, look at hormone testing, what might else be contributing, genetic testing, another one I use a lot, both for athlete performance and more recently get and be pregnant.
Okay, I caught most of that. At the end there, I think your mic again was having some interference.
Okay, I'm going to take my earbuds out and just go live with you. Sorry about that.
No problem. No, I think that's great. So when you are going through all of that, and I think, some people, their pathway changes and they go down different roads, and at least that's how it was for myself. But what's your why? Like, why did you start Altogether Wellness? What did you see missing that you wanted to provide?
Yeah, I think the why for me was really about what my my families needed. What else is going to make them better? And so, I really started this more thinking I'm just going to be a PT in early intervention, working with young children and their families. But as I grew, what I realized was I have such an impact, and it's such a privilege to be in the patient home. And I want to do more for them, and moving away from the medical model and what the insurance covers, unfortunately, just allowed me more freedom. And so Altogether Wellness really is a family-driven, patient-driven outcomes place where we can treat whatever you need. If you want me to meet you on the playground, I'll meet you there. If you want me to meet you in the gym, I'll meet you there. If we need to sit down and talk about lifestyle modification or genetics and how that's going to improve your outcomes, we'll do that as well. And so I think that was really my why, was to make a lasting impact on the families, not just in that moment on their physical outcomes, but in that generational health through a more holistic approach.
Great. Yeah. I don't think you could have said it better, because I think when we were in the clinic and having more of an insurance reimbursement model, we were very limited in what we can do. Our situations only allow us to do things that are billable. And if you were doing more than that, it was a big stress on you, because that time just wasn't captured. And so as a therapist, we all give our patients as much as we can, but now you're in a model that you can really give it to them in an environment that is a little bit more impactful and friendlier to you and them. And so I think that's really, really cool. So what's your ideal scenario look like? Is that, what's your perfect patient look like?
Yeah. So our motto is helping families not just survive, but thrive. And I think that really comes back to, what does a family look like? So that comes from mom, dad, or mom and mom, whatever that looks like pre-pregnancy, all the way through those first few years of life. We know how important that is for setting the stage for success, not just in physical outcomes, but how physical outcomes impact cognition and learning, how early health impacts lifelong health. So things like gestational diabetes and high blood pressure in maternal situations can impact that child throughout their adult life even. So we want to target that whole time period and be supportive. So I guess that looks different for different families. Anything from more traditional therapy services, our coaching to help families thrive in their new roles as parents, and then the functional medicine piece, where I often see either moms coming in wanting to get pregnant and stay pregnant, or have now had children that are a little bit older and they have completely lost control of their own health because they've been so focused on that role in the family, and their hormones are out of whack and they're not sleeping and they're exhausted and they want to get their health back too. So we are there for all of that.
Awesome. Yeah. I think with the model that you're in, it allows you to form those strong relationships, and the relationship-based care is really, really important. Really, really important. I think we have better outcomes. Would you say that your outcomes are better now than they've been in the past?
Oh, absolutely. And I just have that freedom to address whatever they need. It's not limited to what the insurance says is important and a restriction and a billable service. And that has made such a difference that I can do things that maybe wouldn't be considered traditional PT, but are definitely in my wheelhouse and scope of practice. So.
Okay. Yeah, I think you said it right there as well. How long have you been doing this? How long have you owned Altogether Wellness?
So Altogether Wellness has been around for 8 years. Yeah, I know.
Wow.
But I really dived more into the holistic and functional approach for the last 4. So that's when I went through the advanced training and really started opening it up. And I'm excited because we've recently launched some more advanced programs and are building those communities for our moms as well. So it's not just Altogether Wellness and them, but the families that are going through similar things.
Okay. Very, very cool. So what would you say, like in the patients you're seeing now, or in today's world, or how things have evolved over the last 8 years, but what are families' biggest challenges now? Like, what are you treating a lot?
Yeah. So I think one of the interesting things about functional medicine is there's just still a lack of awareness, that's out there. People tend to follow the insurance model, follow the medical model, go to the pediatrician, get the medication. And so here's a great example. Kids who have reflux, right? So we can treat them with reflux medications and that's it, right? End of story, except that does so much to their health down the line. And what if there was another way? So that's one of the simple successes that I probably saw a lot of as a PT, honestly, when we do tummy time and the kids throwing up everywhere and mom's like, this happens all the time. We start talking about it and come up with other solutions. So looking at dietary and lifestyle factors that can influence that. And that you think, okay, well, that's great. They're not puking anymore. They're not uncomfortable. That's huge. mom's not doing as much laundry, so she gets some more rest. Parents bond better with their children because the child's able to be calm and connect with their parent instead of constantly being in crisis because they don't feel good. So there's just so much, right? So that's kind of a big one that I see a lot of that people just don't even think of, but it's a great example of how functional medicine fits with what we do. So yeah, I feel like I'm not sure I totally answered your question. I might have gone off. So direct me again.
No. I love hearing your passion. And so I think that's important for everybody to really hear and feel is how passionate you are about this. And not only are you well trained, but you're able to translate the evidence and your experience into the patient's life that is in a more effective way than the insurance model would have allowed you. And so, I mean, your system now is not only better for you, but for your patients, but the challenges are not just your own. I think the challenge of spreading the word and building people's awareness of what you do and what I do and what other people in our shoes do to better our patients is always very challenging, especially when people have had years and years of insurance-based model care, and that's all they know, what they've been through, and they just think a lot of stuff is normal. And no, you're doing great things. You're doing it right. You're absolutely doing it right.
Well, same to you. I think we need more of us, right? We need more of us out there spreading the word, helping patients understand there's a different and probably better way to do it in most cases.
Yeah, I agree. Different and better, and it's no one person's fault. And this is kind of how medicine started, right? We went to people's homes, we built the relationship. We didn't have to see 30 people a day. We could have just provided better care earlier. So, what's something that you wish people knew about you and what you do? Like the biggest aha moments that you see once people find out about you.
Yeah, I think we've already touched on one of them. So just appreciating that there's a better and different way. And if you're not feeling good about the model you're in, look for something else, right? And I think another big one is the realization that there's somebody there to help you. There's a million, especially as a new parent, you can probably relate to this recently. Right? A million different ways to do it, and everybody has an opinion. And so finding somebody who can walk alongside you and help you guide those decisions into what fits best with you. There's no one size fits approach, but you can find somebody who understands you, who listens to your goals, your challenges, then you can be successful and thrive. And parenting doesn't have to feel hard. But I think a lot of people, that's probably my takeaway, right? Parenting doesn't have to feel hard. And if it feels hard, you need some help. Not that there's not hard moments, but it doesn't have to be hard.
Yeah, it's being a new parent. It's everything. Every new experience, every learning experience has been hard. It's just the challenges and the difficulties along the way, and you learn a lot. I've learned a lot. Absolutely. Wow. So we've talked about why you started, your why, kind of the services that you offer, the things you provide individuals and families, and the way that you're different and unique compared to insurance-based models. Are you currently serving like a certain area of Jacksonville, or you kind of travel all over?
Yeah, great question. So from a therapy perspective, we're mostly on the east side of Jacksonville, although I do have some special clients that have moved, and so we've branched out a little bit. Sure. But we do virtual services. We also offer all of our coaching and functional medicine practices virtually as well. So if that's something that somebody's interested in, we might be able to do it all virtually, or maybe one or two in-person sessions and then do the rest virtually, which makes it really accessible to everybody.
Yeah, that's great. I think, with the challenges over the past 24 months or so, the virtual care has become more of a norm and taking advantage of it, right? We don't have to be limited by zip codes anymore, and Jacksonville's huge. And so I think using that is a really good avenue for you to touch and reach out to your patients. Yeah,
absolutely.
Awesome. So if someone is like, okay, I'm loving what Dr. Quartano is having to say, her practice seems like it's for me, I want to reach out, what's the best way they can reach out to you?
Yeah, our website's a great place to start. So it gives you a little more information about all of our services. There's also a link on there. There's a couple links on there. One that I really like to point out to people is our shop, which is kind of our apothecary. So if you're thinking, we didn't touch on this too much, but my baby needs probiotics, or we're worried about our immunity, or I'm just looking for some clean products. Kind of fits with that whole lifestyle holistic approach. Got a ton of products in there. There's a place that you can contact us. So whether you want to reach out and figure out what product do I want, what service do I need, and are you right for me, book a call. I'm happy to sit down and chat. And that's part of what I love about this model, is I can do that. And then the other thing that's on there is our freebies. So, anything you want to learn more about functional medicine and take a little quiz on that. We've got some new mom resources on there. And then our shopping list is on there too. If you're looking either as a new mom, what do you want to include for yourself, or looking for a gift for a little one in your life, we've got some creative solutions on there for you.
You've got it all figured out. You've had 8 years to really dial in all of this. That's impressive.
Yeah. Well, and it's still evolving, right? That's part of that piece of residency training, is as I learn more, as the evidence and the literature grows, and as my families give me feedback, we continue to mold it and shape it into the best program to help all of our families thrive.
Yeah. Wow. You could not have said that better. Nice. So you went through residency, you're a business owner, you're a mom, you're dual, you've got so many credentials, I probably can't even list them off, but you are dual board certified, which is an amazing thing. You ran residencies, you're still helping out, you're consulting, you're doing all this stuff. Tell me something, tell me a hobby, something you do for fun.
Yeah. What is that, right? You're a business owner too. What does that look like?
This is fun. Yeah.
No, honestly, probably my passion. And so a fun area for me is working out. And specifically, I've been in the CrossFit community for about the last 10 years. So I've stayed active in that way, stayed active through my whole pregnancy, and have been back to hitting some post-baby PR goals, which is fun. But yeah, so that's probably my outlet, and is a good stress outlet for me, but it's also a fun outlet.
Awesome. Yeah, I think it's important to take care of your body. We all know this, and you're integrating that into your life, and not only with yourself, but with your clients and patients. And so you're walking the walk, or you're walking the talk, right?
For sure. Although it's hard to get through a workout some days without a Dr. Jenny question, which is always a good thing.
Well, there's nothing wrong with that either, right?
Yeah. For sure.
Yeah, putting yourself out there in the community and just being a resource for people. And I think what's really nice about the model that we do is that there's not a lot of barriers to reach out to us, right? I'm sure the phone number on your website goes to you. Just like mine, you can email us. We're always here for people, and just giving them, good, strong information that is lacking the external influence that maybe insurance-based model care does. And so can't thank you enough for that. I'm definitely going to be utilizing some of your services or reaching out to you because I'm a new parent, and life can be challenging at times, and your experience in many of those areas. So I appreciate you taking the time and chatting. I loved hearing your story, and I knew a little bit in the past, but this really allowed me to dive into it and just educate the community of what you're doing and getting the word out there about what you're doing and how you're helping people. And so I can't thank you enough for doing what you're doing and taking the time to chat.
Well, thank you. Thank you for having me, and thank you for letting me share this. And, you brought up such a great point. One of the reasons we've gone into this is so that we can be available and help people, right? So if you reach out to me, you're going to get me, not the front desk, not my assistant. And I think that just lends itself to, people are so surprised, right, that they're going to get me and I'm going to answer those questions. And that discovery call isn't about figuring out if I can put you on the books and we can book you for some money. It's all about making sure that we're a right fit for you, and you're going to get better in our care.
Yeah, I know. You and I have both been in the clinics, and we've heard those first phone calls, and it's not about their ailment or the things they're having a problem with. It's always like, okay, what's your insurance? Like, that's the very first question those healthcare clinics ask you. And that really shouldn't drive what we do with you. And so, I'm glad you're doing what you're doing. Keep doing what you're doing. And thank you for taking the time to chat.
Well, you as well. Thank you so much. I'll talk to you soon.
Yeah.